Protesters spread disease. Let's have a look. Hello everyone, Florian.Heise here and welcome to another episode of HeiseSays. I've got my evening stein of coffee and I thought we'd have a look at this article from the ABC discussing just the effect of the protests in Melbourne, the BLM protests, and how there are 8 new coronavirus infections in Victoria resulting from that protest. I was hoping that because it was outdoors and because there have been reports there have been very few infections outdoors, that this would prove that we could open up the economy. That allowing people to congregate in such large groups wouldn't be a problem. But then I thought about it. I was talking to another gentleman when I was sharing this what happened here. And I thought, well, actually, it's not the same as normally going out to meet people. You know, when I'm there meeting on site at a school and I'm talking to a client, you know, sure, we're keeping our distance as you normally do in conversation like a normal person. But that's different to this. These protesters are coming up close together. They're yelling, they're screaming, they've got their placards that they're waving, they're taking off their masks. They're spitting in the air as they're screaming at the top of their lungs with their fanatical devotion to their social justice causes. Does that seem normal? Could that be why this potentially has propagated more? And my concern is the economic damage this will cause, which will probably hurt the Indigenous community here more than others in Australia, sadly enough. Now, I've got no issue. I believe people should have the right to protest and voice their concerns. But it has to be, well, if people can protest, if that's allowed, if we're allowed to open the economy for this, we should be allowed to open it for other things. Like, I don't know, going to the shops, or maybe going from one state to another. All these really, really radical things. All these radical things. And before we go through this article, I want to draw your attention to another article. Another one here. This was released from, the Truth Pundit. German official leaks report denouncing COVID-19 as a global false alarm. So I thought we'd go through just some of these key points here. And this is not the argument that it's all fake. No, it's just an overreaction. It could be a mass hysteria. And I know when people are looking at the numbers, looking at how high the mortality rates are in the United States, you've got to remember, everyone, the density of New York is insane compared to other parts of the world. And there are other... Well, let's not even be PC about this. The Americans are a bunch of fat bastards. The standard American diet is atrocious. There's a number of people that wouldn't even know they're pre-diabetic or that they suffer from hypertension, that have all the comorbidity issues that can make them more susceptible to any type of illness. And, well, I should also say, I'm keto adapted for about 1.5 years, so that gives us an advantage to influenza and the common cold. And that's been medically proven. You can look that up. So maybe I'm a bit biased in thinking that I'd be fine if this illness ever came to me. Germany's federal government and mainstream media are engaged in damage control after a report that challenges the established coronavirus narrative leaked from the Interior Ministry. Some of the report key passages are: the dangerousness of the COVID-19 outbreak was overestimated. Probably at no point did the danger posed by the new virus go beyond normal levels. The people who died from corona are essentially those who would statistically die this year because they have reached the end of their lives and their weakened bodies can no longer cope with any random everyday stress, including the approximately 150 viruses currently in circulation. And that, well, every time there's a flu. When my father was in the home, the aged care home, they would lock down the whole thing. They would disinfect everything, just a normal flu. Because, frankly, you're old. Your body's weak. It's run down. That's what happens, everyone. Worldwide, within a quarter of a year, there have been no more than 250,000 deaths from COVID-19 compared to 1.5 million deaths during the influenza wave of 17-18. And here's the thing. The problem is, We'll never know if that was because of the super effective lockdowns or if because people overestimated the death rate from this illness. The modelling that was done in the UK with regards to the potential risk of this illness has been proven to be completely incorrect and have significant issues in it. UK now have admitted that they've fared no better than Sweden, which didn't impose any lockdowns, didn't severely restrict their economic activity. I don't know why. I do not know why we didn't just implement the same policies that we do in aged care facilities or with those that are more acutely at risk of catching or dying from this illness, and just restrict those people or get them to take extra precautions. Why didn't we do that? No, we had to shut down the entire economy. How many livelihoods were destroyed? How many people's liberties and rights were curtailed? The danger is obviously no greater than that of any other viruses. There is no evidence that this was more than a false alarm. I mean, honestly, this would not be the first time that we've experienced mass hysterias. But we're living in a different world. We're living in an interconnected digital world. So mass hysteria, which is like a virus, which is propagated through social media and through information that people are provided, can expand exponentially. A reproach could go along these lines. During the corona crisis, the state has proven itself as one of the biggest producers of fake news. So far so bad, but it gets worse. The report focused on the manifold and heavy consequences of the corona measures and warns that these are grave. Many people are dying because of state-imposed corona measures that are being killed by the virus. And I will link to that article if you'd want to go to it and have a look at the report in detail. But that is interesting. That is interesting. And let's have a look here at discussions about what's happening in Melbourne. Do you feel it's been an overreaction? Do you feel that the restrictions on the economy have been worth it? Victoria has recorded 8 new coronavirus cases, including one person who attended a Black Lives Matter protest in Melbourne on Saturday. So now all those people there are potentially exposed. Chief Health Officer Brent Sutton said the man in his 30s was very unlikely to have acquired the virus at the protest and was not showing symptoms on the day, but he may have been infectious at the demonstration. Yes, that is exactly the point. He may have been infectious, and people won't know for 2 weeks. This is the problem with it. This is the problem. Before everyone starts randomly getting immunizations, we need to start massive antibody testing. Because how do we know that it hasn't swept through people? There's arguments there's different portions of the virus. Remember when it first came out? And there's this horrific flu going through everywhere. How many of you got it? I hope that anyone who has attended that protest, and indeed across Victoria, who developed symptoms that are comparable with coronavirus, really needs to isolate themselves, get tested, get the results back, and become well before they go out and about again. No, not if you showed symptoms. If you attended one of those protests in either Sydney or Melbourne. Oh, I know he went into it in Melbourne. So if you have the protest on Melbourne, you need to self-isolate. So you've been so selfish that you're virtue signaling going to this protest. Now you've got to self-isolate. Isn't that fair and reasonable? Shouldn't that be expected? I'm sure you could find out everyone who went on the Facebook lists. It is estimated 10,000 people attended the anti-racism protest in Melbourne on Saturday that was calling for an end to Aboriginal deaths in custody. I mean, okay, it's a very complex issue, very nuanced, and, well, the biggest concern I have is the government is throwing so much money to bridge the gap, and it's completely failing. When you look at some of these remote communities, the amount of money and departments and resources they're throwing at them to try and bridge the gap, it's completely failing. You're taking a civilization that frankly survived in a desert of a continent. There's nothing here. They survived here. They thrived. And it's not the noble savage. It wasn't a utopian bliss that everyone pretends it was. But they survived, and that should be respected and appreciated. The worst thing we did was bring them our bloody diet. In a Facebook post on Monday morning, the Warriors of the Aboriginal Resistance group told its followers they should self-isolate for 14 days, not visit elderly people during this period, and should speak to a doctor if they develop any symptoms. Victoria's COVID-19 restrictions still only allow gatherings of up to 20 people outside. Oh boy, see, look how close they all are. They're not social distancing, are they? They're not social distancing, so I wonder how many of them are going to be shitting themselves. And here's another thing. The problem is, I mean, look at this. This mask is useless. This is useless. This is useless. All of these masks aren't really going to work very well. I'm sure they'll help you from, spittle and stuff like that. They'll be better than nothing. Don't get me wrong, but it's not a proper gas mask. But how many of them you think are rampant lefties? So they're not eating a proper diet. I know it's always coming down to food because everything I've looked at has I watched a lecture yesterday where a doctor was presenting at Low Carb Down Under, discussing how keto diets are used as a complement to cancer treatments. So how many of them you think a high glucose, they're spiking themselves, they're eating soy and all this other vegan garbage, they're probably quite at risk. Anyway, back to this. Most of those at the demonstration on Saturday were seen to be wearing masks, and hand sanitizer was given throughout the day, but crowds were tightly packed at many points. Professor Sutton said it was obviously helpful the man was wearing a mask, but warned masks were not 100% protection. He said the man was diagnosed through routine testing and the Department of Health and Human Services would go through the normal process of identifying close contacts. Authorities had earlier said it would be 1 to 2 weeks before the full impact of the protest on transmissions of the virus was known. We were all concerned about the possibility of transmission occurring at that protest, Sutton said. We really need to keep an eye out for new cases to see if there was community transmission. Professor Sutton said he did not know whether the demonstrators had downloaded the COVID-safe app and how the man had contracted the virus was still under investigation. Well, that doesn't matter, because you just get all 10,000 people to self-isolate for 2 weeks. I'm sure they're fine. I'm sure mum and dad can pay for their living, and maybe they're already on the dole anyway, or student youth allowance. They'll be fine. The quarantine requirements are for known contacts of a confirmed case, but anyone who develops symptoms, no matter how mild, does need to isolate. He said, no, everyone should isolate. Make everyone isolate. Just tell them, you have to isolate, guys. If you are, think about it, the Aboriginal elders that you're worried about, they're at high levels of risk. Their population has a high risk of they've got a high level of comorbidity that can increase their likelihood to suffer from this illness. Self-isolate, or you're a hypocrite. It's just 2 weeks. Put that on your hashtag. That especially applies to those who've been to the protest, because we know that they've had potential exposure, but it applies across the board in Victoria. Let's just build a wall to Victoria, guys. What do you reckon? Thumbs up if you think we need to build a Victorian wall. So childcare centre closes after the toddler contracts COVID-19. Professor Lynn Cochrane Early Childhood Centre in Parksville has been closed for 24 hours for cleaning after a toddler who attended the childcare centre contracted the virus. The Department of Health and Human Services said the child was not showing symptoms while at the centre, but could have been infectious. Staff and children are required to remain at home while contact tracing occurs. We will update the centre, community and the public when this has been completed, Forbill, who runs the facility, said in a statement. Well, I mean, this is the thing. You send your kids to anything like that, the diseases just go run wild. The common cold flies through them like anything. It is nuts. We understand this news will be concerning for families, our team of teachers and educators. We want to assure everyone that we are strictly following the public health advice of DHHS to ensure the safety of all children and staff. The outbreak at Ridges on Swanton Hotel is now linked to 15 infections after a household contact of another case tested positive. The hotel in Melbourne CBD has been used to quarantine return travellers. Professor Sutton said there'd been a thorough review process of the Ridges to try to determine how the initial transmission occurred to prevent such a spread happening again. The review included looking at how personal protective equipment was used and disposed of, cleaning arrangements and understanding of social distancing. All of that's been reviewed, but there will be a further digging into what might have happened to see if there are further recommendations to make. A person who has previously worked at the Bupa Aged Care Facility in Carlton has also tested positive. They did not work while infectious, but all staff and residents of the facility were being tested as a precaution. 2 of the state's latest infections were detected in returned travellers in hotel quarantine, while 2 more were under investigation. So, there you go, guys. There you go. My hopes that these protests would prove a positive for the economy, because they'd show that the infection is gone. We've got it under control. The risk of infection in public spaces hasn't occurred. We'll have to see. I mean, this, in some ways, if he didn't get it at this event, if he went there and was infected, and then we see in 2 weeks it hasn't been, we now know the virus has been present at this protest. So if in 2 weeks' time there isn't a jump that resulted from this in Melbourne, that adds more argument to open up. Right there. Because how it was initially reported, how I heard, it was like 8 people. No, it was only 1 person at the BLM protest had the virus, not 8. Not 8. So only 1. 8 new cases, sure, but only 1. There. And that's our test case. We'll test that. 10,000 people, what do you reckon? We'll have to see. Were you at the protest, guys? Would you be willing to risk the infectious disease for these causes? As always, let me know your thoughts and opinions in the comments below. Do you think this is a overreaction? Or do we need to close down the economy to save just 1 life? Should we close down the economy for the rampant number of people that are suffering from pre-diabetes? Or what about Alzheimer's, also known as type 3 diabetes, that is taking away people's quality of life? What about the rampant amount of heart disease? All of the sugar and vegetable oil that's in all of our food that has been proven to cause health issues. Or all the false news that's coming around other food. I think a lot more people are dying of that than this illness. And there hasn't been this crazy reaction. My concern is that this is going to push a lot of the Western world even further towards a socialist dystopia. As always, please let me know your thoughts and opinions in the comments below. Please like, share, and subscribe to the channel. If you're a fan and want to support the content I create here, there are a few ways you can. You can join the channel on YouTube or Patreon. You can support us via our affiliate links at Amazon or eBay or Independent Reserve and Kucoin. You can buy our merch from HeiseSays, or you can support us via PayPal. Take care. I'll see you next time.